Tick bite treatment protocol, take 2. Hey everybody, whether or not you know it, we are seeing a massive increase in tick bites on the East Coast, Wisconsin, Michigan, over on the West Coast, and many of my patients have suffered from long-term sequelae from a tick bite or some sort of a bite that carried a vector like Borrelia burgdorferi, which is the classical Lyme disease, like tick-borne relapsing fever, other infections like Bartonella or Babesia or Ehrlichia, and many, many others. And I'm testing and treating these every day and seeing so many people are affected. So one of the things I want to talk to you about today is a simple protocol that if you do get a tick bite, you can take for prevention of disease. And I have found it to be quite effective. So I want to share that with you today. Before we do, I wanted to just share a couple statistics. According to the CDC, 476,000 people are diagnosed and treated for Lyme disease every year, and that's only increasing in incidence. It's initially was concentrated in the northeastern United States, but it's really spread to all over the US and has been reported in every single one of the states in the US. So it really can occur anywhere. And even though, like I'm in the state of Colorado, which is less endemic, we see a lot of the soft ticks. So we see more of the tick-borne relapsing fever types of diseases. And Babesia, Bartonella are in all of the states as well. So super common and more incidents as we increase encroachment upon formerly wooded and remote areas, and suburbia is, translocating into these areas, and the ticks and the deers that carry them are also in those areas. Traditionally, Connecticut, New York, Pennsylvania, upper Midwest like Minnesota, Wisconsin, even Illinois, where I grew up, is very common. And between 1993 and 2018, the number of counties in the US considered to have high incidence of Lyme disease increased by more than 300% in the northeastern and mid-Atlantic state, and 250% in the north central US, like Minnesota and Wisconsin and Illinois. States like Maine, Vermont, and New Hampshire have seen substantial increases, with Vermont considered to have the highest per capita incidence. Global trends are there too. So those in Europe aren't escaping. Sweden, Germany, Austria are especially common. And in Canada, Lyme disease has also been steadily rising. So this is really having a global impact. And the truth is, even if you get bit by a tick, it doesn't mean you're going to get Lyme disease. But I love being able to offer something that children and adults can take if they do get a tick bite, just to hopefully decrease the incidence of infection. So you'll find this at drjillhealth.com. It's called the Tick Bite Treatment Protocol. And it's a company called Nutrimetics that makes these wonderful herbal products. I'm going to share them with you and tell you just a little bit about them. It's a trio of products. You have the Mora, the Houttuynia, and the Samento. So you can see those there. I'll try to do it this way here. So we have Houttuynia, Mora, and Samento. Samento has been one of my go-tos forever. It's cat's claw and especially good for viruses and traditional Lyme disease. It typically works, and especially if I have a patient who has a lot of joint pain and fatigue, I'll often start them on this and get some reprieve. Houttuynia, the second one here, sounds like petunia with an H. That one is used as well for tick-borne infections. I find it particularly good for Bartonella. So it has a little bit more coverage there. And then Mora traditionally has been kind of a gut formula, but also very antimicrobial. It's a tincture of yarrow flowers, Capirona bark, and Blackberry leaves, which has multiple antimicrobial effects. And so I'm not claiming to treat disease here, but for prevention, it's a great protocol. And I'll typically have people take 30 to 60 drops 3 times a day for 30 days if they have been bitten by a tick. So you can find this trio here with a discount at drjillhealth.com under Tick Bite Prevention Protocol. And again, you get all 3 of these tinctures. And I would recommend, if you have gotten bit by a tick and want to prevent any sequelae, you can do this and do that for at least 30 days. So hopefully that's helpful today. This has been Dr. Jill, and I hope to see you again soon.